primary care should know that the number of regulatory agencies that are getting involved in the management of chronic pain seems to be growing by the week. It, at one point in time, involved pain organizations like the American Pain Society, the American Academy of Pain Medicine, the Food and Drug Administration since 2011 has become integrally involved with the post-marketing prescribing of opioids, REMS being probably the most evident part of their movement towards influencing what prescribers do, followed by the Drug Enforcement Administration, followed by the Center for Disease Control, the Joint Commission, the Center for Medicaid and Medicare Services, and the like, and the number of regulators that are becoming involved in this arena just seems to be growing and growing. It can get very, very confusing for people in primary care. So the point that I try to drive home to healthcare providers is that with all of these different regulatory agencies being involved, the one that often doesn't come to mind is the Federation of State Medical Boards. People need to be aware of what their state level requirements are. In my mind, what I would like people in primary care to know is to know what the requirements are of them in their state. To not walk away from managing patients with chronic pain, but to see what they can do to comply. So in the event that the state medical board comes knocking, they will be compliant with what's required of them. I find the challenge being the most pressing for people in primary care is who to listen to. Do they listen to the Center for Disease Control? Do they listen to the FDA? Do they listen to the organization that provides them the ability to write prescriptions? There seems to be a lot of tumultuous activity going on, and my biggest fear is that what it might do is cause people to step away from the table. And if that happens, the people who suffer the most are the patients with chronic pain. So it's a challenge, and it's one that I think can be very trying for people at the Main Street level. It really can. What I think is important when I talk about staying on the rails is following some set of guidelines that meet the requirements of the state you live in, but also making sure that the patient doesn't get lost in the shuffle. I think a lot of people think when I talk about staying on the rails, it means having a pristine medical record to look at. So if somebody wants to come look at it, they can say, I pass all the tests, I had everything documented. I worry about the fact that the patient doesn't get lost in the shuffle. And to me, if the patient does get lost in the shuffle, then it goes off the rails. I think that keeping a good medical record is one thing, but making sure that you take the best possible care of a patient and not abandoning the patient is just as important.